Hi, this is Dr. Bren Boston on my thoughts about longevity. Briefly, I think the most important aspect of longevity is being lean and fit. This is because your lean muscle mass is how you stay strong and energized and capable and able as you age. If you don't continue to exercise, then your muscles will become replaced with fat cells over the course of time. That's called sarcopenia, and it is the normal course over time as we age, but we can fight against it and prevent it with exercise, at least to a certain extent. As you age, you want to stay strong so that normal everyday tasks are still easy, so that you're not a fall risk, so that you're still vibrantly participating, in life. Um, and the way to do that is just to start exercising regularly before you're old. People who exercise regularly when they're in their 60s, 70s, 80s, they still don't seem old because they seem spry and flexible and they have good balance. So, exercising, I think, is the most important aspect. You want to do at least 3 days a week of weight training. That's for maintaining your lean muscle mass as well as your bone mineral density. In addition, you want to stretch on a regular basis, say like 15 minutes a day. And you want to do some cardiovascular exercise, which, depending on your age, it may be tennis, it may be walking, it may be jogging, it may be biking, maybe swimming, but something that helps with your cardiovascular endurance. The next most important thing that contributes to your being lean and fit would be the foods you put in your mouth. So every time you have a meal, you have a choice of what to eat. And you can either eat foods that promote your longevity or foods that potentially could take away from your longevity. Of course, with flexibility, because I think every now and then you could literally eat anything you want and that's fine, but just on the most part, you want to eat in general an anti-inflammatory diet. After you take care of those two things, and then also hydration, because your body is 60% water. So if you're not hydrating optimally, then your cells are like little shriveled raisins. They don't like to function that way. So you want to hydrate yourself. You don't want to overhydrate yourself because you can mess up your electrolyte balance, but you want to make sure you're adequately hydrated. What's really important as you age, for your skin, for your joints, for all of the cells in your body, to have adequate hydration. If you're going to sweat a lot, you probably want to add some electrolytes to your water. Like I'm sweaty right now. I just did a jog. I had a big electrolyte water to replace some of those salts that I lost. After you take care of those things, and then some other lifestyle factors like making sure you get enough sleep, making sure you have good social connections and stress relief, making sure you know how to find joy, then as far as longevity goes, I would look to, well, what am I likely to die from and how can I prevent that? So if you live in the United States, the number one cause of death is cardiovascular disease. This is heart attacks and strokes. The number two cause of death is cancer. And the number three cause of death is accidents. So let's start with number one, cardiovascular disease. So you want to do things that don't promote having a heart attack or a stroke. So this would include not smoking cigarettes, because tobacco smoke causes blood clots, which causes heart attacks and strokes. Not doing other things that can easily clot your blood. So that's, being chronically dehydrated, taking oral estrogen. So as we age, after we're not making estrogen anymore, you want to make sure that if you do replace your estrogen, that you do it transdermally. That's a whole nother talk. Then you want to make sure you're not promoting plaque buildup in the arteries of your heart, because that causes heart attacks. So you want to make sure you're limiting your saturated fats and your trans fats in your diets. If you have high LDL cholesterol, despite a healthy diet and exercise, it might be genetic, and in which case you should take a medication to lower that LDL. I fully believe in the research behind lipid lowering medication for longevity. Another thing that makes you more likely to have a heart attack would be high blood pressure. So you definitely have to treat high blood pressure if you have it. You do all the lifestyle factors first, exercising regularly so that your resting blood pressure is lower. Your resting heart rate is lower, eating well, not eating a processed diet, getting enough sleep. You're doing all that stuff. You're not carrying a bunch of extra weight and you still have high blood pressure. A lot of people do. It's genetic. It's called essential hypertension, in which case you need to take a pill to lower your blood pressure. That's really important. Then we can move on to cardiovascular screening and prevention. So you want to make sure that you have checked on the health of your heart. And so typically this is done with a cardiologist. Talk to your own doctor about what age you should do this, but I like to have people do this as a prevention, like before they've had a symptom. So you want to be having an echocardiogram, which is an ultrasound of the heart. It shows like how well your valves are moving, how well the walls of the heart are pumping. A coronary calcium score that shows if you have any plaque buildup, an EKG, which checks the electrical rhythm of the heart, and just a whole cardiology baseline intake. As far as cancer screenings, the best thing you can do as far as avoiding cancer is to do screenings when you're asymptomatic so that you can catch it early. Because in general, across the board, when cancer is caught early, it's much more treatable. And if it's caught late, it's harder to treat. So it's important to have your screenings for cancer. Probably the first screening you'll have for cancer would be skin cancer. You should definitely be going to a dermatologist every single year and having a total body skin check for skin cancer. And skin cancer is the number one type of cancer in the United States. Fortunately, most of it is basal cell and squamous cell carcinoma, which will not kill you, almost never, but it does need to be treated. Also, they'll screen for melanoma, which can kill you, but that's not as common as the squamous cell and the basal cell that many people will have during their lifetime due to the carcinogenic effects of UV radiation from the sun. Women will have breast cancer screenings starting age 40 and pap smears for cervical cancer screening starting typically age 25. Men will have prostate cancer screenings with a blood test, depending on their doctor. It might start at 40, 45, 50. You also want to have colon cancer screened starting age 45. You'll have eye cancer screened. It's not specifically talked about, but when you go to the optometrist and you have all those eye tests, they're screening for glaucoma and retinal diseases, and they can see if there's, one of those rare eye cancers growing inside your eye during that. So that you should probably have your eyes looked at every couple of years by an optometrist to check your vision as well as those other aspects of eye health. Then there's oral health. So you should be taking care of your gums by flossing every day, brushing twice a day, getting your teeth professionally cleaned at least twice a year. And, during that cleaning, they'll see if you have some sort of unusual findings, which might lead to a diagnosis of oral cancer. So that just happens to be a little bit of a cancer screening too. Then you also want to try to avoid dying early from accidents. So you want to just play it smart, be safe. If you're riding a bike, wear a helmet. If you're driving a car, you want to have your seatbelt on. There's all sorts of things you can do in your life to make good decisions and not risky decisions as far as accidents go. One of the main questions I get about longevity is, is there a magic pill that I can take that will help me live longer? What is the supplement that I need that will give me eternal youth? And the answer is there is not one. Definitely, it's more important to do all of the lifestyle factors that we've talked about, more important than any supplement or vitamin or pill that you could take. That being said, I do take some supplements that I do think improve my health. I take vitamin D. I take methyl B12, methylfolate. I take CoQ10. I take collagen. I take creatine. I take curcumin. I take calcium. I take magnesium. So I do take some supplements, but they are supplemental. I think the most important things that I take are vitamin D because I will not get enough in my diet, and I would be deficient without taking it, and vitamin methyl B12 because I have an MTHFR genetic variant, so I'm not turning active all the B12 that I eat, and I also don't eat a lot of B12 because it's in animal foods only, and I eat vegetarian a lot. I'd say those are the two most important things I take, but I take other things too. I also am on bioidentical hormones, but in my opinion, it's not part of my longevity. It's really part of just feeling good rather than extending my life. It's like improving the quality of my life, but I don't think it's extending my life. So if you're in the bucket of people who cannot take bioidentical hormones because a strong family history of breast cancer or whatever the reason is, don't feel like you're limiting your lifespan. You're not. And there's many other things you can do besides bioidentical hormone replacement, during perimenopause and menopause to help you feel good. So that's my 2 cents. Most of the things that you can do to promote your longevity are free, except that they do take time and effort. And if you work part-time like I do, it's obviously a lot easier. So I definitely know if you're working full-time, sometimes doing all of these things, getting 8 hours of sleep, exercising every day, finding healthy foods, like it's not easy. I get it, but it's worth it if you're able to. So here is to a long and healthy life.